Hello, everyone. I'd like to present a digital story about clinical research and consenting of patients. This story about a decision that has to be made by a physician. He has to make a choice between fulfilling his legal obligations as an employee of the hospital and fulfilling his ethical obligations for his patients that he had promised to provide the best possible treatment. This story begins with a call that was made to a 911 department that identified a patient in a suburb area of Orlando with a possible stroke. Doctor concluded that the patient has to be immediately delivered to an emergency room for an examination and a surgery. This patient was delivered by a helicopter. The patient is at the emergency room and the physician is examining the patient and reviewing diagnostic images. After that, the conclusion was made that this patient has to have an immediate intervention to minimize the size of the stroke. Surgeon has to make a hard decision. The problem is that while the traditional approved technique may help to resolve an issue, there is another research procedure that can definitely benefit a patient, and the research method has been approved, but it is still on the fourth stage where the consent by the relatives is required. The informed consent should be signed in person at the hospital. The physician is hesitant as he knows the procedure would save patient's life, yet his legal obligations will be compromised. The problem is that patients' relatives are traveling by car and it will take them another hour to reach the hospital. Therefore, they can only agree to this procedure by phone. This is legally not appropriate measure that is not approved by a clinical study since they have to be in person at the hospital to sign the consent. The doctor understands that this formality can get him in trouble, but he also understands that the issue needs to be resolved immediately and he cannot wait. He makes the decision to proceed with the research procedure and saves patient's life. At the next committee meeting, the doctor needs to present an explanation for his actions and verify that all that he has done was performed in the best interest of a patient but yet is legally prohibited. The doctor, the doctor presents all the facts and explains the importance of the decision that has been made from an ethical point of view, that he has an obligation to do what is the best for the health and safety of his patients. Legal authorities of the hospital will need to review the case from the legal standpoint and protect the interest of the patient. The conclusion was made by the legal department to approve the decision that has been made by the doctor, and it was decided to change the standard operating procedures to include the comment that the research protocol should be changed to accept the consent by relatives by phone in such an emergent situation. This story analyzes the issue from both standpoints, ethical and legal. The story proves that if the doctor keeps in mind the best interest of the patient, he should not be bypassing the legal obligations as a researcher. Legal and ethical issues intercept a lot in healthcare, and only interdisciplinary approach may help to solve this issue. Both disciplines should be taken into consideration while solving clinical research problems.